All right. Well, it looks like we have a big population of M3s, which is fantastic because this is our Sketchy Clinical experience. And we have 3 physicians here to chat with you today. And we're going to be reviewing hyperkalemia management. Oh, Andrew, I know. We'll have to bring Andrew next time. All right. So we have 3 of us here from Sketchy today. Hollis, do you want to introduce yourself?
Sure. My name's Hollis. I'm a PR physician. I graduated 11 years ago. And I'm still working as an ER physician. I work for Sketchy as well. We wanted to include some banana fun facts. So mine is that even though they're part of a brat diet, they're actually very good tempered.
How long do you workshop that one for? Hey guys, I'm Ben. I'm the creative director here. I used to be a urologist, and then I realized that my fate was in making cartoons for you guys. My banana fun fact is that notwithstanding their suggestive shape, bananas are in fact sterile and can only grow new ones by cuttings. The seeds don't do anything. Or there are no seeds or something. No.
And hey, I'm Lauren Fisher. I am the director of medical curriculum here at Sketchy, and I'm an anesthesiologist by trade. I graduated PCOM in Philadelphia in 2003. And my banana fun fact is that bananas are technically classified as a berry, and that has to do with the fact that the seeds are on the inside, which then confused me further because strawberries, but anyhow, that's what I learned about bananas in prepping this.
Fun fact, strawberries are actually classified as a banana, so.
Who knew? So our plan for today is to give you a really brief intro, and then we're gonna hop right into the lesson. And we have time at the end for Q&A, and we also have a special discount code for those of you who came to hang out with us tonight. Feel free to ask questions at any time, either in the Q&A or in the chat. And we also have a giveaway at the end, which is pretty cool. And I know that the invite said that we're going to keep it to an hour, and we're going to be true to that and stay true to form. So we're going to keep moving this along for you.
Actually, just out of curiosity, if you throw a 6 in the chat, which looks kind of like a thumbs up sort of maybe, if you use Sketchy, and throw a 9 in the chat if you don't use Sketchy, and don't forget to change your chat thing to everyone. Just curious to see. But so if you haven't used Sketchy before, it's as hopefully these glorious pictures will make clear, a visual learning platform. It's been used by more than 400,000 students at this point, mostly med students. And it's kind of a key med school resource because it's fun, because it makes studying easier, it helps you remember stuff better, and because it improves your scores. I'm obviously biased, but I use Sketchy as a med student, and so I can vouch for it on that totally separate third-party level for sure. So if you're wondering if Sketchy would work for you, if you're the kind of person whose cells make ATP, then Sketchy is good for you. So if you want to remember stuff quickly, if you want to keep it in your head forever, and if you actually want to have genuine fun while you're studying, welcome to Sketchy. That said, almost everyone put a 6, so you already knew all that without me telling you.
Well, I'm going to review how we came to this lesson that we're going to be talking about today. This lesson is part of our Clinical Essentials collection, which launched about 2 weeks ago. And Clinical Essentials was designed by our clinical team to get you from your step 1 studying straight into rotations. So we kind of curated this really awesome collection of fun, interesting, very high yield, shorter lessons. Our average lesson length is 10 minutes. Excuse me. And We're going to be talking about hyperkalemia today.
This isn't the COVID lecture, Lauren.
No, Lauren.
Oh God, no, I'm about to regret making that joke. Are you okay?
Yep, not dying.
With us?
Our clinical collection consists of 4 courses: internal medicine, peds, surgery, and OBGYN. And we kind of selected the hottest topics of those 4 courses and loaded them up for you in collection.
Cool. So let's dive right in. Lauren makes it. So.
By the way, are y'all going to intubate me? Because
I'm wondering.
I think you have to do that to yourself.
We need an airway.
Wait, can you pop back one to just the background? So this is our hyperkalemia lesson, and before we get too far into it,
Whoa.
That was our hyperkalemia.
That was too far. Too far, my friend.
So if you take a look at this background, you can see that it's kind of like a nice, bright, sunny day. And so what we've done for our electrolyte lessons is split them so that hyper-electrolyte abnormalities are in sunshine and hypo abnormalities are at night or in darker spaces. So just an initial visual clue to help you remember what we're talking about. And then as you can sort of tell from this jungle monkey thing we've got going on here, each of the electrolytes has kind of a different theme to keep those consistent. But so today we're talking about potassium, so we've got some monkeys. I think we're going to hear about this shifty looking dude. Sketchy looking dude?
He's a little sketchy. Actually, can you go back one? I mean, it just erases the EKG vine, but I can talk about my guy in the upper right-hand corner here. He is representative of pseudo hyperkalemia, which is something that you definitely want to rule out. You can see he's in a monkey suit. And pseudo hyperkalemia can result from doing things like drawing your lab near a potassium infusion, or leaving your sample out to cool, or just from lots of lab errors being transported next to a bag of ice. Someone has ordered a lactic acid. So we want to rule out pseudo hyperkalemia.
All right, not dying. So the next thing we want to talk about, the next symbol that shows up here, is our continuous EKG vine. And you can see the EKG comes across the top, and it's a memory trigger to help you remember that we want to do continuous cardiac monitoring as well as frequent EKGs in order to monitor for the cardiac rhythm and also look at for any morphology changes that we might see in hyperkalemia. So do y'all want to throw into the chat, what are we looking for specifically in our morphology change in an EKG? Yeah.
I see a good answer.
Very good answer, peak T waves. So you can see in our vine, we have that visual of the peak T wave, especially here across the top. And this is going to trigger your brain as you remember the vine that we have to keep checking the EKG and also look for those T wave changes.
So the next thing you want to do when thinking about hyperkalemia is try and figure out sort of what might the cause have been. So we've highlighted our sketchy dude's briefcase in red to help you think of labs. You can see all those test tubes sticking out of it. So, get your sort of usual basic set of labs, BMP, CBC, the sort of normal stuff. You want to look at renal function, but also think about what specific risk factors or things your patient might have that might inspire you to get some other labs. So, if you're thinking about rhabdo, check a CPK. If you're thinking about tumor lysis, get a uric acid. So generally get labs and then think specifically about what your patient might have that would ask you to get something special.
So at this point, our monkeys show up on the left side of the screen, and you can see that their tails are configured in such a way that they have a 6.5 shaping with their tails. And that's going to help us remember that 6.5 number as being really a key pivotal value. If the patient is symptomatic, their hyperkalemia is greater than 6.5, or even if it's a little bit lower and they've continued ongoing risk, that's going to trigger our memory that we really have to correct this pretty rapidly. And we're hoping that that visual cue of the 6.5 for the tails is, again, something that's going to stick in your head.
Yeah, and if you look at those monkeys are not chill, right? They're panicking and freaking out. So that's your clue that this is like a problematic level.
With their ripe bananas.
If you see a nephrology attending and your patient has that potassium, that's kind of what they're going to look like too. So
yes. Okay, so we've established that we have an emergently high potassium level. So the first thing that we're going to do is what this kind researcher is doing. She's calming this monkey, which is symbolizing calming the cellular membrane. We want to decrease the excitability so that we don't have any more EKG changes. And so what do we use for that? We use ice cream because, number one, ice cream fixes everything. But number two, because it's going to make us remember IV calcium gluconate, which is your first line medication when you have a very high potassium level.
I know I always get calmed down by ice cream. So
do you? I do too. Find it very soothing.
It totally works. My wife does this to me all the time. Shut up.
So we've included the symbol continuously across our content with the ice cream calcium. So that way it'll be one of those recurrent symbols.
So that helps stabilize the membrane, but we still have the high potassium problem. So the next thing that you'll probably want to do is get the potassium out of the blood somehow. And a quick way, although not a permanent way of doing that, is to shift it into cells. So there's a couple ways of doing that. One is insulin, which causes potassium to shift into cells. But then you want to give glucose with the insulin so that you don't put your patient into hypoglycemic shock or something. So this guy's packing bananas inside. And if you've seen Sketchy before, inside is our recurring symbol for insulin. And then our little slogan there, "Go Bananas for Nature's Candy," reminds you that you should also give glucose with the insulin. That looks like he's having a good time.
So another way to shift potassium inside the cell and decrease your elevated potassium level is to give a beta agonist. And we symbolize this at Sketchy with our beta bugle. So you'll see this guy tooting his beta bugle and forcing potassium back into the cell and out of the place where it can cause problems.
And another way that is potential for treating hyperkalemia, which is a little bit variable utility, we might say, is to give sodium bicarb. It's really only useful in patients with significant metabolic acidosis, but we do know that sodium bicarb is going to increase our pH and therefore activate the sodium potassium pump and continue to drive the potassium out of the blood and intracellular. So variable utility, you may see it, you may not, but at least you know that it's an option, especially in a patient who has significant acidosis.
All right, but enough kicking the can down the road, right? This is all just like moving potassium around into different spaces, but it's all still in the body. So what we really need to do is get potassium out. And there's a few different ways of doing that. But so we have this kind of surprised looking researcher lady grabbing the banana from that monkey to symbolize the idea that we're taking potassium away, we're taking it out of the body. And then that monkey's got some big thighs and a loop tail. And so if you've, again, watched Sketchy before, you know that thighs are a recurring symbol for thiazide, and that loop is for a loop diuretic. So these are both, you may not have heard them called this before, but you can think of them as potassium wasting diuretics. So they help you excrete potassium. So that's a popular option. There's also sort of other fancier things like GI cation exchangers, one of which is sodium zirconium silicilicate. So that monkey's little fake diamond zirconium earring is to help you remember that funny GI cation exchanger. You may also have heard about polystyrene, which has a problematic side effect of colonic necrosis, so we try not to use that. And then last but not least, you'll notice that that researcher has a funny machine on her back, the AEIOU machine, which is our recurring symbol for dialysis. So dialysis is another option for getting rid of too much potassium. That's the E in the AEIOU electrolytes, not potassium. So that's how you get potassium actually out of the body and stop wishy-washing, just pushing around into cells and stuff.
So here we have a book you can see that says, for mild-mannered monkeys, limit bananas. And this is to symbolize mild hyperkalemia, non-emergent chronic hyperkalemia. And in this case, we wouldn't rush to give any of these medications. We can change some of the patient's daily medications that might be causing potassium buildup, limit their exogenous potassium intake, but just limit bananas, limit the K. No need to throw all these meds at them.
So as far as using Sketchy, now that I've stopped dying, we have sort of 3 different avenues for you on our site. And we believe in spaced repetition, and we believe in memory encoding and making sure that these symbols are really sticky. So that way you have retention, because it's one thing to like read something on a page and maybe 5 minutes later you can recall it, but we want you to recall it in times of stress. We want you to be able to recall it when you're taking exams, when you're getting pimped on rotations by your attendings, when you're really under stress with the patient situation. We want this all to be very easily accessible to you. So our 3 methodologies that we have are the familiarization, memory encoding. That's watching the Sketchy video lesson on the site and reviewing it that way. And then you have an opportunity to consolidate those memories and rehearse them. And that's using our Sketchy review cards, which allows you to quiz yourself and look at the different symbols and click through. And we have the option to put the symbols on versus keep them off. And that way you can kind of quiz and test yourself. And then finally, we have our very carefully created review questions, and that will allow you to reinforce this information and continue to quiz yourself.
Okay, we have a couple questions here. I'm going to give you guys a second to read through and go ahead and put your answers in the chat. Okay, so some things that will stick out to you potentially in the question stem. She's currently having acute gouty attack in her right knee. She has some medications that, some colchicine, got called serum potassium 7.1. There is a little line in here. Lab notes that there were long delays in processing specimens due to equipment malfunction. So that kind of puts it in our head. Is this a real value? Should we be doubting this? She seems fine on her presentation. So we're going to repeat the lab draw, but that takes a while. And what's the next most appropriate step? So the next most appropriate step, are we going to assume that this lab value is correct and administer IM calcium gluconate? There's something wrong with that answer choice as well. We definitely want to give IV. That was kind of a mean question writer answer. The second one is discontinue lisinopril and start a low potassium diet. I don't think that's what we want to do. Her serum potassium 7.1. We're kind of wanting to address this if it's real. C, place on a cardiac monitor and obtain an EKG. That seems pretty reasonable. We want to see if there's any peak T waves. We're not, sure if this is a real value, but if we see peak T waves, we definitely know we're going to be treating fairly quickly. Chastise the patient. She obviously went on a banana bender. No, you can just, save that for later.
But what if you like yelling at the patient a little bit?
I mean, things must be different in urology, but the next one is order serum, uric acid, calcium, and phosphate. Not super applicable. I mean, she does have, she's having a gouty attack, but right now in this scenario, uric acid, not really applicable. So what I would do in the ER is immediately place on a cardiac monitor and obtain an EKG. We want to see if this patient has peak T waves. Is she bradycardia? What is she, what is her heart doing? She has those peak T waves. We're going to immediately give calcium gluconate. We're going to stabilize that membrane, give us a little bit of time to go through the whole treatment algorithm. We'll probably give the IV insulin and IV dextrose, glucose shortly after.
And does anyone remember what the symbol was for that cardiac monitor and continuous EKG? You can throw it in the chat. Yep, we're looking for peak T's for sure. Yeah, it was the vine.
Fine, yeah.
So in my head, I can close my eyes and I can picture that vine, and that's going to help me remember the sequence of what we need to do.
Yeah. And when you're dealing with medications that can affect the heart, putting someone on a cardiac monitor before you give them is always a good idea. Just life lesson.
For sure.
Yeah.
LPT.
Okay, our next question, go ahead and read through. Okay, so this character has type 2 diabetes, chronic kidney disease, and he's been taking naproxen twice daily for months, which just sounds like a terrible plan for his kidneys. So he presents the heart rate of 52. You grab an EKG while you're waiting for your labs, and you see sinus bradycardia and you see peak T waves. Your creatinine comes back at 3.2. So we don't know if this is new or old, but then we see our potassium is 6.7, which is fairly concerning. And he's already having EKG changes. So what's our next most appropriate step in management? So go ahead and throw your answers up. So question choice A, answer choice A, administer IV insulin with PO glucose. I'm a little concerned about giving IV insulin a large amount and then just PO glucose. I think I'd be a lot more happy with giving IV insulin and IV glucose together, because I know I'm not going to bottom out someone's blood sugar. B, administer IV calcium gluconate. That seems pretty reasonable. Stabilize the membrane, make it make the cells less excitable. Hopefully they won't progress past those peak T waves. Option C, start a daily outpatient thiazide diuretic. We're kind of wanting to move a little faster with this patient, so I'm going to skip that one. Obtain a nephrology consultation for emergent hemodialysis. We're definitely calling nephrology about this patient, but they can't solve this problem faster than you can. So you are the doctor here. You have to pick something before you get nephrology. And switch patient from naproxen to acetaminophen. which is a fantastic idea. We're definitely going to be doing this, but that's not going to fix the problem that's in front of us. So I'm going to circle back to administer IV calcium gluconate as the next best choice, because you're going to stabilize that membrane.
And another fun clinical pearl, because you are hanging out with your sketchy clinical friends tonight, is that if, as an anesthesiologist, if I'm going to be pushing my insulin and my glucose, which do you want to push first? IV insulin, IV glucose.
Anybody?
I'm seeing some glucose votes for sure. Yeah, so we want that glucose in first, because if for some reason the patient goes one of those and you lose your line, you want, if they're a little hyperglycemic, you have time to fix that. If they just got a whole boatload of IV insulin, they're going to become pretty hypoglycemic pretty quick, and you're going to be really struggling to get that line under pressure. So I always push my glucose first.
You know, people are going to do that on rounds now. Well, we don't want the patient to do one of those.
Do this. Always prepare for the worst.
Yeah.
Well, they
Ready
rip out
for
like
worst case scenario at all times.
They spin. And they rip out their lines and they keep
You
spinning.
do these things.
Yeah. But great questions. And there was a question in the chat about the patient isn't dialysis eligible.
This patient will probably end up potentially on dialysis. I think that, you know, in this case, you would leave that decision to nephrology. We're in an ER setting, so we're going to treat them. If their creatinine doesn't recover and they continue to decline and be unable to process potassium, you're probably going to end up putting this patient on dialysis. But it won't fix the problem in the short term. I don't think that was your question. Of course, you can get emergent hemodialysis. You have to do something before that. You're getting
you have to stabilize that myocardium, or else you're going to end up with dysrhythmia. This patient's going to get worse. So that's why the calcium is so important, to stabilize the myocardium as your first step in treating hyperkalemia, which all comes down to ice cream.
Yes, it does. Just
yes.
The answer is always ice cream. Is really what the take home is for tonight.
Yes. So definitely stabilize the myocardium first. I did also see a question in the chat about a first-year student, and we're so psyched that you're here and joining us tonight. Please do not stress about these questions.
You're totally fine.
This is well beyond anything that you would need to know at this stage in the game. This is our clinical content, and it's a great opportunity to talk about how we've designed this content to bridge that gap between the basic sciences and the clinical presentations that you're going to see. But please don't freak out. Please don't stress. You're not expected to know this right now. You're doing great.
And look at people giving her support. That's so sweet. Gives me hope for the future. They're right. You're going to do fine.
And as far as emergent hemodialysis, their renal function while high is not emergently high. That's sort of a trickier clinical question because we don't know what their baseline is. So
exactly.
I can't tell you for sure if this patient's a dialysis candidate or not. Probably not with a creatinine of 3.2, but you know, either way, they're acutely hyperkalemic right now. So we have to stabilize the myocardium first and keep them safe. Okay. So a lot of things in medicine come down to acute versus chronic, and things that are chronic, we can tolerate amazing things because the physiology is fantastic.
Yeah. And this might be an acute renal injury from the naproxen, and maybe in a few days, the creatinine, the kidneys will recover. Too early to say, someone else's problem. ER.
ER doc.
Go into ER.
So we wanted to kind of talk a little bit about how to use some of our content here with our Clinical Essentials product. And like I had said earlier, we kind of pulled this greatest hits of things that we thought were really crucial to know for starting rotations. And one thing I wanted to point out in that top right corner there is that we have a search bar. And every one of our Sketchy screens has a search bar in that top right. And our students have been utilizing it really fantastically. We know that a lot of you are using other resources. Maybe you're doing some question banks and realizing that you're struggling with a particular area. And that's a great opportunity to use our search bar, figure out where we might be able to supplement some of the other materials that you're using. And if you find that you're really struggling with the concept, I bet we have a sketch on it, and we can help to make these concepts more sticky, maybe explain them in that visual setting that will help you to really drive home those concepts and remember them. So please continue to use our search bar. And I wanted to highlight that because that just came out a couple of months ago from our fantastic product team was able to get us that. So we did have some time for Q&A. Please feel free to throw some questions in the chat. This is sort of an ask us anything. We can talk clinical, we can talk sketchy.
Yeah, put it in the chat, or I think we have like a Q&A feature in Zoom that you can use. We'll answer questions we get wherever they are.
All right, so I see a question from our MS1 who's thinking about what they should be doing this summer.
Oh my gosh, you should enjoy your summer. You should travel. You should eat all the ice cream. You should do nothing related to medicine and just enjoy your summer. This is the last summer of your life. Enjoy it.
A literal doctor just told you to eat all the ice cream. So
all the ice cream, like enjoy.
Yeah.
Watch videos here and there. Great.
Yeah, I personally, I like to kind of use my free time to refresh concepts. So my summer after MS1, I did go back and I did questions and I did review some studying. Ben has already called me a gunner. It's fine. I've accepted that.
Feel free to add in the chat though.
But Sketchy is a great product for that because it is entertaining and it is the kind of thing that you could watch it and not feel like you're hardcore studying or sitting down and reading Robbins for the summer. As optimistic as I'm sure you all are, no one is going to sit down and read Robbins for the summer. But we would love to know that you're watching some of our Sketchy, doing some casual review cards, quizzing yourself with some of our question banks, and more are being loaded into the clinical product as we speak. So it's a great tool to use while you're chilling out, and you don't have to feel like you're hardcore studying, but you're still assimilating that knowledge.
Watch Sketchy by the pool.
Even that's aggressive. I feel like travel a lot, and then you have a lot of flights where you can watch Sketchy, but then put it away while you're on.
That's fair. Yeah.
There was a question about how beta-2 agonists lower the high potassium.
They stimulate the sodium potassium ATPase activity, and it kicks them into the cell.
Yeah, so it doesn't remove it from the body, but it does shift.
No, it's a shifter. Yeah,
it's a shift.
Yeah, it's one of those shifty shifters,
Shifty shifter. Yeah, the whole video is a little bit, it's easier to understand from watching the video in its entirety. We kind of just picked certain symbols to show you, but yeah.
And there was a question from an IM resident for step 3. And yeah, we have tons of IM content and we're adding more and more each month. So I think that it might be a nice refresher, especially as you go out on your subspecialty rotations. If you get farmed out to another service, that Sketchy is a great resource to be able to have that quick review. And I know a lot of students are telling me that when they start a new service, they've been doing some Sketchy the weekend before. So that way they just feel like more prepared. They have the lingo down. And they feel kind of ready to tackle those new challenges. There was a question about the B1 bugle and the B2, is it a tuba?
Yeah, Rachel, in our sort of autonomic drugs, one of the autonomic drug sketches, we separate them out a little more, and typically elsewhere in Sketchy, where the distinction tends to be less important, we kind of compress the whole brass, not woodwind, right? Brass section, just like the one bugle. So yeah, here it's representing specifically beta 2, but in a scenario where you're probably not going to be asked to make the distinction between.
And, as you know, most of our drugs do have some beta 1 and beta 2, and it just depends on the ratio of what receptors it hits. Sketchy Medical app, we don't currently have an app, and there's a number of reasons for that, but part of it is because this allows us to update our content really continuously, whereas updates on apps are much different to be able to update. So we do have our web-based service for that reason, so that way we can continue to get you the most current content. We are piloting some ideas though. Ben, do you want to talk about Sketchy Flip?
Yeah, so, we totally understand the desire for like something that you can carry around in your pocket. And so that's something we spend a lot of time thinking about. Like Lauren said, an actual app is probably not actually a good solution just because the freaking app store process is so painful. But we're working on something called Sketchy Flip. That's kind of it turns the review card into a quiz or like flashcards a little more than we do right now. So that's been prototyped. We've gotten a lot of good feedback on it so far. And actually, if you are interested in that or stuff like it, check out our Discord where we advertise, beta testing and sort of new product features that you can test out a little earlier. I think somebody can put the link to the Discord in the chat, and you can head over there. And there's a way to get into that kind of beta testing pipeline.
And there was a question about how do I find clinical essentials? So we have a collections on your main screen, and I'm going to stop share for a minute and I will load our Sketchy site. And show you where to find it. All right, so we're going to log into Sketchy Medical. And it's right here in our collections. So here's our clinical essentials. And I'm going to click my See All button. And this is where all of our essentials are loaded. And so you can really pick whatever you want to see, or if you're looking for something specific, you can always use our search bar, and this will pop you straight into the video.
Oh, look at that happy little feller.
Oh no. Yeah, there's a question about sketchy pharmacology.
Oh, do we have stuff in pharmacology? Oh, you're about to
be yeah.
so happy.
Share screen again. So back to our home site. Our Sketchy Medical subscription gets you access to both Sketchy Preclinical as well as Sketchy Clinical. And here's all of our preclinical subjects, and we have pharmacology. So tons and tons of pharmacology lessons. And also, using the search bar, if you're looking for a particular drug or a particular class, you can definitely find it there. We've got lots of fun.
Yeah, SketchyPharm is pretty sweet, not gonna lie. Except that we got rid of that absolutely brutal collides lesson.
All right. What else? Yeah, we talked about the beta agonists activating the sodium potassium pump.
You're inciting a riot, Ben.
I know I'm trying to start fights here in the chat. Yeah, Rachel, it doesn't have to. You don't have to say was the best because it's still there. If you go to Pharm and antimicrobials and scroll all the way down, there's a retired lessons section, and the OG macrolides video is hanging out down.
And there's a question about pseudo-hyperkalemia.
What is our question?
They want us to talk about it.
Oh, the causes or just
A brief
you'd be
soliloquy
surprised.
on the topic.
So if you have a patient, say you have a patient that's like fighting you, like, you know, a 4-year-old that you're trying to get labs on, and you have like a prolonged tourniquet time, or they're just like really, really fighting, you can get hyperkalemia. You can get it from the blood tubes just sitting at the lab and not getting processed. You can get it from so many different things. You get it from elevated white blood cell counts.
So it's basically like a lab error, basically.
Lab error, yeah. You'd be surprised how many times labs get drawn next to an infusion that may contain potassium. So you always have to kind of, you know, or, you know, lactic acid, the tube needs to be transported in ice. And if your test tube is right up against the ice and it gets too cold, you might end up with falsely elevated potassium in the sample.
And you might hear that, you know, the sample's hemolyzed.
Yep,
So
hemolysis.
you know that'll spill the potassium from that's supposed to be intracellular, it'll spill out. And so you'll hear like, oh, but it's hemolyzed. And that's sort of another way that we see the pseudo-hyperkalemia. So it's not real. So if you have a hemolyzed specimen come back,
ignore all this.
Well, redraw.
Yeah. quickly redraw.
So process of coming up with the ideas for the sketches.
Oh wow, yeah.
Yeah, so much fun.
That's a whole thing. Yeah, so our content team, so Lauren and Hollis build out a curriculum for our courses and decide sort of what lessons we want to teach, what material we want to teach. And then my team, the creative team, works with them in a process we call the mind smelt. That's not a real word. We sit down and have kind of like a jam sesh where we go through the lesson and think of funny, memorable symbols for each of the kind of high level points that we want to teach. And we have, those sessions are kind of weird winding processes where we go off on tangents and do weird Google searches, and yeah, Hollis can attest to it. Things sometimes get strange. We have a lot of ideas that we toss out. And so hopefully at the end we're left with just the really memorable, awesome ones.
And it's very cool for me, you know, coming from a medical background, to see the creative side of things. And that's something that was very new to me joining Sketchy. Sketchy was not a thing when I was in school. And I first learned about it from my med students, and they were explaining to me, you know, how it's so awesome and it helps them remember and it keeps things really sticky. And now being able to be part of that process and seeing the artists draw and really see the creative side has been really fascinating, coming from a straight up, you know, science medical background.
Yeah, and we have amazing artists that sketch stuff out, and they're unbelievable. They can make anything in seconds. It's
very impressive. And yes, Rachel, the recurring symbols, it's a double-edged sword, you know. Sometimes it's a huge help. It's like, oh, cool, we kind of know already what the theme is going to be here. We've got a bunch of the symbols. We just sort of figure out the rest. And sometimes it's like, all right, now we have to have bananas in our space underwater setting. So like, what are we going to do now? So it's a help and a hindrance sometimes.
Yes, and Thank you for trying the practice questions. But don't panic on the clinical side of things. You have time.
I will keep going. I will keep going is the motto. Just keep going. That's the mantra.
And ignore the people that said they studied the whole summer. They're just trying to throw you off your game.
Probably something Lauren would have done.
I did not, no.
It's important to keep your brain kind of thinking about the concepts, but you really enjoy yourself. You have time.
Yeah, definitely.
We have a question about nursing.
Yeah, we're
Nursing?
currently trying to figure out the nursing curriculum, and we're speaking with some nursing advisors to see where we might be able to add value there. So to be continued, to be decided. Stay tuned for that. All right. Yeah, so there's a question about our questions, and our questions are directly aligned with our lessons. So that way it reinforces the content. So it's part of the spaced repetition concept to make things memorable for you. And there was a question about the end of webinar special, so I can go to that.
What an organic transition.
Yes, thank you. So we have our free trial availability. So we encourage you to sign up for a free trial if you haven't done so already, and gives you a chance to access our products, see what it's like, try it out completely for free. If you are interested in buying a subscription, we do have a discount code. It expires on May 22nd. So it's a May 10. So it's 10% off. And it expires May 22nd at 11:59 Pacific time.
11:59. You got that? Not midnight. 11:59. Lauren, do you want to share your screen so they can see that discount code?
Oh, excuse me. Yes.
Brittany put it in the chat too, but
Yep, I apologize. I had taken that down when I was screen sharing our website. So it's right there, May 10. And we do have a survey on the way because we'd love to hear feedback on, what we can do to help you all and what kind of stuff you want to see and what you want to see in the webinars. And just as a reminder, we do have different subscription plans, different lengths. Our most popular is going to be our 12-month subscription plan. And to sign up for the trial, you can go to our website at sketchy.com and sign up for a free trial that way with your email. And yes, I believe the code does apply for any of the plans. So any other questions, anything we can help you all with? Oh boy, I think give you all a new crane for sure. Oh, there's a question on the code.
I think if you just hit the left arrow, and it'll go back.
You would think. there's kind
Do you get that, Margarita? All right, perfect. We have
Yeah.
videos in the theme room. Sure do.
of do. Yeah. Trying to make that all sticky. Are those prices with the discount already? I do not believe so. I believe those were just the regular prices.
Right now, I believe it's just a one-time payment. For renewals, we're working on an option to pay monthly, and that's something that we're sort of constantly evaluating. So.
Yeah, but thank you for that feedback. That is something that we will kick up to our marketing team and see if that's an option. We
Sure.
definitely appreciate hearing what our students want. Yeah, monthly. We'll consider it. Obviously, these are not decisions that Ben Hollis and I make in Zoom meetings, but we definitely appreciate the feedback.
Someday, Christine, someday. Seems like people want a monthly option. It's good feedback. They're way too. I guess the chat is recorded too. I think so. We've got these comments stored. Chi-Chi, if you go to the site and put the code in, it should show you what the price would be before you have to buy it or anything. Gifting, that's a good question. I don't remember. You guys know?
Can we gift sketchy accounts? I do not know. But you're giving us some great ideas.
Product team's going to murder us, but keep them coming.
I'm taking notes. Make a gift certificate. All right, well, that's a good idea. Is the code good for extension? I believe it is. And the extension doesn't start until yours runs out. So you still get the benefit of your full subscription, and then it'll pick up after that.
Coming up on 5, so any last questions before we release you back to your evenings?
How's everyone doing tonight? Are you studying? Code, yeah. May 10.
That's sufficient, Rachel. That's the way to do it.
Oh, okay. Hyperkalemia is done.
Knock that one off. And to whatever fourth year was here, go away and never come back. That's not true. You're gonna miss us in residency and you'll come back.
Yep. It's a great resource for internship as you're continuing to rotate through different services for sure. The next one, we haven't planned it yet. What do you want to see? What do you want to learn? Rachel wants to learn biochem. Ooh, EKG. You've got some great
We got a sweet
EKG content. So for EKG, maybe EKG basics, and then we go through a whole bunch of the different arrhythmias and narrows and the wides. So we have some great memory tricks for that. Chest X-ray. Yep, we have a brand new lesson.
I love that lesson.
Oh. All right, we are hitting the hour mark, so I think we are out. I'm going to stop share. Thank you all.
Thanks, everybody. Appreciate you coming out.
Have a good evening.
Have a great night.